The reason that I use this case a lot is A, it's a very simple case, and B, it demonstrates several very important points for me. I've used it a lot in clinic and, repeatedly gotten certain issues that come up that I feel are very worth discussing here. Good. The case itself is the case of an individual that I treated at one of my practices. He was a senior executive in a car manufacturing company, and he had retired some years before after a very successful career. He was a wonderful, charming man, devoted to his family. But the case is a case of early in its onset, not early onset, but early in the onset of dementia, a very severe memory weakness in this individual after a long bout of stress. Here it is. So Brian was in his mid-80s. His wife of 4 decades had passed after a prolonged bout of cancer. He was a totally devoted husband, and the trauma had been devastating. The response to Ignatia and Natrum Mur was initially very good, but after several months, there was a kind of decline in his vigor, and the decline did not carry any symptoms characteristic of a particular remedy I could identify, but soon a complaint did develop. Brian became very forgetful. Now, I didn't continue with the rest of the case. It's really quite straightforward. And it identifies a number of issues that we will come across. But I wanted to talk about it verbally. So when I questioned Brian about his memory loss, he just looked at me blankly and said, I just can't remember things like I could. And I know that it's getting worse and worse every week. The daughter, who was sitting there, echoed the same sentiment. But memory loss puts us in the same ballpark as sadness. How can I more identify Brian's original exquisite experience of disease? Exquisite, not meaning wonderful or enjoyable, but exquisitely described, exquisitely nuanced and detailed experience of illness. So I used that same question, and I said, Brian, when you say memory loss, what do you mean? I tried out that same pattern. And he said, I just forget. Then I said to him, does anything else come with that forgetfulness? And he said no. And he kept thinking. And I knew he was thinking because he was leaning back and his eyes were pointed upward. And he said, wait a minute. I do get a kind of feeling with all of that. And he looked again at me. And I said, what kind of feeling? Say a little bit about that. And he said, it's a feeling as if air were in my head. And what I did was, I said, that's fascinating. Say more about that. And he looked at me and he said, well, there really isn't anything more about it. It just feels like there's air in my head. So while he was sitting there, here's what I did. I went to the repertory, and as soon as I got my cursor going, I went to the head chapter. And I noticed this particular rubric, air or wind. As if a current of air or wind. So I said to him, does it feel as if it's moving in any way? And he went, no. Does anything feel like it's going through the head? And he said, no, it's just air in my head. There were no defining modalities or other features or other symptoms except for memory loss, and that doesn't help. So I continued, and I said, I need more tools here. I need more ability to find that particular sensation because it is exquisitely defined. So here's what I did. I went to the search function, and I wanted to find a remedy as close as possible, having those two parameters. Air in the head. No movement, no thermal shift, no sense of going through, just air in the head. So we find that we have 438 remedies. Not great. 9,000 references. That's impossible. I go back. How can I specify it? I added the word in. Oops. Air in the head. Okay. 165 references, 38 remedies. A lot more doable. Now, let's start reading these. Here's actia spicata. No, that's not what I want. It says vertigo in the open air. That's not good enough. Aeschylus. There was a chilly sensation when riding in cool air. Now, that doesn't even come close to what I want. Smoking in the open air. Heat in the head as if surrounded by hot air. Let's think about that. Heat in the head as if surrounded by hot air. No, that's not it at all. Head aching, air in, sensation of. Head aching from Allen in Aurum. Oh, Aurum is complementary to natrum mur, and there is that sense of depression. Maybe that's so. But then if we just go back down, we see from Ward and Herring under benzoic acid this idea, sensation as if there were air in the head. And look at it. It is cited in multiple places. Now, Aurum has it in association with a headache, but this is the raw, precise symptom. Then I go down, and if we go down all of it, better walking in the open air, as if the head were floating in air, head aching, reeling, as if head were freer in the air under phosphorus. Nowhere do we find that precise symptom as beautifully stated. So, if we go to benzoic acid, which had that so beautifully, now let's go to one of the bigger sensation as if there were air in the head from herring. There it is. Sensation as if there were air in the head. Now, let's also look at another primary, a more primary source. Herring is not a primary source of symptomatology. So let's go to Allen's Encyclopedia, head. And we have all sorts of head sensation here. Okay. We can see if it came from Allen. Ah, there it is. Sensation as if there were air in the head. Now, could this occur in an individual suffering from memory loss or Alzheimer's? We don't look for Alzheimer's. We don't look for dementia necessarily. We look for the altered feeling or function. So we're now in the head section of Allen, which is more a primary source because it has more proving data. We go to the mind. Okay. Sadness, certainly that was here with his grief. He was much surprised that while writing, he omitted words at every moment, which was never the case before. Oh, so memory can be an issue. And it can occur in someone who's dwelling on unpleasant things, who is sad, and who has anxiety. This hits all the high spots of my case. Based on this, I gave benzoic acid 30 to be taken daily to this individual. The result being that inside of 2 weeks, his dizziness and his memory loss were much improved. He was a different person. I believe this is the kind of process Hahnemann was talking about.